Thank you so much, guys, for making the time to join us on this LinkedIn Live. And apologies to the audience on LinkedIn for starting a little bit late. We've been trying to get the other two panelists, moderator and the speaker, but they are not able to join in at the moment. However, we will start the conversation right away. Today, as we had advertised earlier on or shared on the LinkedIn page earlier on, we are hoping to discuss healthcare in Africa, but through research and innovation, and how this could actually help the continent accelerate access to healthcare services in different parts of Africa. And I'd like to introduce my panelists. Suneka Samuel, I'm going to give you like a minute to introduce yourself, and then I'll bring in Jenny, and then we can kick off the chat.
All right, thank you, Maggie. Hi to all the audience out here. My name is Samuel Seneca. I'm a pharmacist by training, and I lead the global client success management team for Zipline. With a little background of myself, I have a master's in monitoring and evaluation. I've since also been working in the hospital space for about 10 years before I left as assistant and emergency pharmacist. I've been working with Zipline for the past almost 4 years now in trying to build systems and then trying to strengthen healthcare supply chain in most African countries, and also working with in the American hemisphere with some very known partners like Walmart and then One Health and other agencies there. In Africa, I've been able to work with the governments in Ghana, Nigeria, Kenya, Rwanda, Cote d'Ivoire, in trying to incorporate the Zipline technology to strengthen the supply chain in this particular ecosystem. We've had a lot of strides in these areas, and we are looking at how to also expand this particular innovation and technology to other countries in strengthening the supply chain and healthcare systems in these particular areas. So basically, that is what I do in Zipline, and then the particular background that I have in this respective area.
Okay, so hi everyone, my name is Jenny, and Jenny Mokwe, and I'm the CEO and founder of Clafia. Just a bit of a background about me. So I'm a systems engineer by training, and I have about 8 years of experience in that field. I spent the bulk of my career working in the US federal government. And then shortly after that, I got tired of working in the, the public sector, and then went to the private sector where I worked at Deloitte and then at Amazon, now working on Clafia full time. Thank you.
Thanks, Jenny. Thanks, Samira. I think, well, you know, one of the reasons we're having this chat, Jenny has dropped off, but I hope she joins in back again. She just joined in again. Jenny, we have you back. Is to really look at how technology and research can help accelerate or address the persistent challenges we have in the healthcare system. Obviously, when we talk about technology, we also factor in investment, you know, we factor in policy. There are a lot of other factors that play within. We've had COVID-19 in the past, we've had Ebola, we've had a lot of these health challenges that we've had, that we've also had to draw experiences from. If I wanted to, I would love to set the stage for this conversation on technology, and probably ask you, Samira, with what we've experienced and obviously learning from that and being able to say, you know, we gotta innovate and be able to provide access to all the people across Africa with the challenges that we have, electricity access, internet itself. Where are we?
Okay, so I think one of the biggest areas that we have lacking in the healthcare space has usually been like limited access to quality healthcare, inadequate infrastructure, shortage of trained healthcare personnel, and this, and also actually inequity in access to quality healthcare, where we have the market actually fluctuated with fake medicines and then fake medical equipment as well. And then if you are looking at how technology is solving the challenges, we need to look at the baseline of the challenges, and these are some of the challenges. With COVID also coming in, we also see how it actually exposed most of the challenges, like very poor planning in supply chain management, and that is where we are as we have been as a continent. But moving forward, the question also has to do with how do we make sure that we use technology innovation to better our game in these respective areas. And I think there are a number of we can actually use technology, and one is actually areas of like telemedicine, where we have a seamless integration method where people can actually call in, give in diagnosis, or like get diagnosis, talk about their symptoms, and then get diagnosis for their symptoms, get have a platform where they can actually order for medicines, and then they have a system that actually delivers the medicines for them, right? And you look at this as an end-to-end solution to what is actually plaguing people and then the health systems in general. So that is one area that I'll also look at, and then also I'll be looking at point of care testing, where whenever somebody goes to a facility or whenever there's an outbreak, there should be that technology that actually equips itself that people are able to get testing where they actually go in for treatment. With what Zipline is able to do, where there have been challenges in actually equal access or universal access to healthcare. That is where Zipline actually tries to bridge the gap, where we leverage the drones that we have in delivering medicines to health facilities. Also, there's that need where there's that challenge where most health facilities do not have very good data in forecasting their consumption patterns, and thereby usually store so much of products to expire, and also to the detriment of other health facilities. And that is where Zipline also comes in, where we have a central warehouse where we store these products, and then we have real-time delivery of these products to any facility that has an active case that needs urgent attention. With the technology that Zipline has, a typical kind of supply chain that would have taken 1 hour or 2 hours to deliver, Zipline does that in less than 15 minutes. And that is the areas in which we think when we start to strengthen the supply chain system, we are able to better overcome our challenges as a continent.
Listening to Samir on what Zipline has been able to do in reducing the gap or the hours of delivering blood in rural areas. I really wanted to bring you in and talk about, for example, the work you have done about with connecting patients to health care workers in rural areas, which I think is really very important. Is that actually is it working out? Is it feasible? Like, how does it even work like?
Yeah, so I mean, with Clathia, right, we center our healthcare around two core people. One, the patient, and one, the health practitioner. We're leveraging community health workers and nurses because they are, really embedded in the communities that we serve. And so I like to describe Clathia as a, digital primary healthcare center that exists on your mobile phone. And so two of our channels that we have, such as our USSD-based platform or our web app, but most customers access us through our USSD platform, which means that they can access our services through a phone that doesn't require internet, or you don't need a smartphone to access our services, right? We have community health workers, officers, and nurses in these communities, and we basically build an ecosystem around them. And so essentially how it works, our patients will register on a platform via USSD or web app, and then they can schedule an appointment with the nearest available community health worker or nurse in their community to provide primary care services. So they are equipped with the kit that allows them to do, just do a vitals check, some rapid diagnostic tests, other things like first aid, like things that, are the CHOs and the nurses are trained to do. And then if they need continuum of care, we have partners with hospitals, pharmacies, or other health tech startups or brick and mortar entities in the healthcare value chain that we can refer our patients to for continuum of care. So let's say after our patient has received a consultation from us, be it in person, right? We found that our patients really, really love that in-person experience. I like the value of telemedicine, but telemedicine can only do so much, right? And a lot of our patients really, really want to be seen. And so our health practitioners would meet the patient wherever they are, be it at school, at work, or at home, at church. And if like after the consultation they needed medicine, right, we have like partners with other health tech startups that can deliver the drugs to our patients, so like they're not having to navigate the fragmented health ecosystem by themselves. If they needed like diagnostic testing, we have partners who can come to their home and collect a
Yeah.
sample, take it back to the lab, and then they receive the results from there. If they need to go to the hospital, then we send them to a hospital that is closest to them. And so that's how we've been able to bridge that gap when it comes to access, which is basically helping the patient on their journey to access healthcare in a more convenient way, time, and affordable way as well, but also leveraging the resources in the community for our patients to get access to healthcare, primary healthcare.
I mean, I really want to ask both of you, and I don't know if Samuel, you would jump in on this, but when we talk about e-health or even technology, one of the questions for me is always infrastructure. Is this something you've come across, and how are you dealing with that? I can imagine even probably being able to operate the drones or being able to send a blood. In most cases, you will hear, one of the biggest challenges people tell you, I think the first infrastructure is is being a hindrance to most of these things that we're doing. Is this something you've come across, and how are you dealing with that?
Yes, so infrastructure is obviously one of the challenges that we as a technology actually deal with, because you don't have this kind of technology on the open markets where you have like very easy way of getting infrastructure to build it and then actually scale it. In most often than not situations, we have had to contract people, design systems, and then test them before they are actually rolled out to just serve zipline, and then what we are able to do. However, the other way would have been also looking at how infrastructure comes into play in putting infrastructure in each and every hospital in the country that we are going into, right? Let's say Zipline is serving the least number of facilities that one of Zipline centers serves is around 200 health centers, right? And then we are looking at infrastructure in the hospitals, like having stable electricity, having communication, having storage equipment, and all that in each and every hospital, right? When you're taking a typical hospital settings that is able to do blood transfusion, they should be able to have a freezer to accommodate fresh frozen plasma. They should be able to have fridges to accommodate their vaccines, their blood. They should be able to also have towers that could actually thaw the fresh frozen plasmas for patients' use. The question is, how much investment is going to go in each and every these 200 health facilities? And that is where you would see that government is not able to actually see the feasibility in able to do provide each and every infrastructure to the health centers. But this actually Zipline takes it as a painstaking point where we are able to invest in infrastructure in our distribution centers, so that each and every facility within our catchment radius, be it 200, 400 health facilities, they don't need this infrastructure actually in place to be able to give people quality healthcare. But Zipline having it centralized means that each and every facility that we serve also indirectly has this infrastructure in use, because we are able to serve them using our infrastructure. Some of them are so very expensive. That is also because the technology is new. But as we work and scale, we are looking at how to actually source these in a much more cheaper level. And Zipline is also working on different platforms where we are looking at actually platforms that require very little infrastructure and yet very robust and competitive as the platform that we have with heavy infrastructures. And we believe one with that is also rolled out, that is actually going to increase the traction in each and every aspect that we are scaling to, and also actually increase healthcare service access in each and every country that we should be operating to.
Thanks, Samuel. I want to welcome Dr. Sango Dele. Thank you so much for joining us.
First of all, Thank you for having me, and with my other panelists. And greetings from Libreville. They just concluded the One Forest Summit.
I want to bring you in, Samuel. Dr. Sango mentioned something very important, and for me, that's really capacity. And one of the things I think also we keep hearing is the need for research and development. Is it something you can talk to me more about?
Yes, so thank you for that. I think Dr. Sango mentioning about capacity, traveling around and then looking at the capacity in each and every country. Actually, we have this global standard of health systems capacity, but then we also have country-specific needs for the kind of capacity investment that they also need to put in there. And then we also have investor aims, where these investors are looking at what do I necessarily want to invest in this particular country, and what are my aims and objectives with the kind of development I want to see my organization supporting, right? And I think that is where there is that uniqueness in there. But then when it comes to research and development, which actually is very core in strengthening health systems, there is the need for identifying actually different parties that actually we should go into research and development into, and then the respective interests of the different parties, where we look at the uniqueness of each and every party, and then where there's an intersection that we can actually work together. If we don't have a very core goal, or one goal, then at the end of the day, there is going to be lack of collaboration in actually doing research and development. And also there is actually going to be very huge cost burden, where we spend so much money in research without impact and outcomes, right? And that is where I'm looking at what are the similarities that each and every party that will be going into research and development with, what goals do we need to set? And what are the targets of these goals, right? There should be a very direct target in the lives of people that we are trying to serve. There should be, goal setting that is also achieving things like the Millennium Development Goals. Just trying to solve global health issues, and not just limited to even countries or continents, right? But we look at things from that bigger umbrella. I'm also looking at even areas in which there is this multilateral partnership building, where when you have different partners coming into play, we have, we are able to mobilize resources from different angles to give in very concrete researches. One of the things that I usually fear is the fact that research and development actually ends when pandemics end. You would agree with me, when Ebola ended, then each and every resources that was allocated to Ebola just dwindles, and then COVID has ended. So there is no actually monetary allocations now going to combating COVID. But then there would be the pre-COVID combat, there should be COVID combat, and then the post. And usually the post will have to do with research that evaluates indicators that was actually effective in combating COVID, that we should keep, and then other indicators that didn't actually affect the COVID pandemic that we should just do away with. But are they actually happening? We understand, and that is where we are lacking as a nation, and we might take things for granted with the fact that COVID is now on the decline, and then we limit resource allocations to post-COVID researches and development. Then we are struck with another virus, and then we come back to our senses. So we are always in a reactive stage and never in a proactive stage, which I think is a mindset that we need to start changing, and then actually realigning on how to be more proactively in dealing with issues using research, data, and development than always being in a reactive mode.
So it's more of we have to prepare better. It's more like pandemic preparedness, and we've seen and learned from the past that it was kind of a shock. We have to cushion some of these emergencies. Dr. Sang, I want to bring you in because earlier on, Jenny mentioned to me, she said, we cannot do health through VC funding. And obviously, as we spoke about infrastructure, or even listening to Samuel talking about research and development, I mean, the question that comes to mind is financing and meaningful and financing to really support R&D collaborations with African universities. And obviously with COVID-19, when we remember about with the vaccines, it was about where do we get the money? Where do we were literally getting help donations, but there could have been a chance to set up factories, to really set up laboratories that could actually not just produce COVID-19 vaccines, but also produce other vaccines. And we've seen, for example, Senegal take a step ahead in terms of building such infrastructure. Now, to bring to my question, which financing models really would support something like this and accelerate innovation and a bit of creativity in the healthcare systems across Africa?
So, like all things African, I think that there's a lot of nuance involved.
Yes,
right. I've spent time now in about 47. A lot of them have similar health challenges. They are on different parts of the care. With respect to financing, I will wholeheartedly and admittedly buy funding is not appropriate. What we have done in our 30x our reach in a matter of a few years wouldn't have been possible without. I don't think venture funding is the panacea for all our issues, but I think it's one of multiple, but all the above approach as we look at financing. We need venture funding to be able to the exponential impact of it works out. Right? We absolutely need that because as I disease burden, we only have 3% of global healthcare workers and 1% of global healthcare expenditure. See, that's required for us to bridge the gap that business as usual isn't going to do. It's going to bring about some innovation. It's going to bring about some scalability but it will not solve everything because all our healthcare is not going to be solved. Patient capital. We also need government capital, right? We also need the nonprofit. The chain will require different interventions, right? And so some parts of it, I think, market-driven approaches, and others simply would not make sense to just leave the market, right? And we'd have to approach to that. But ultimately, at the end of the day, when I think about the size of our financing, the one of the biggest issues, because irrespective of how debt finance, project finance, venture capital finance, however you think about it, there has to be from these healthcare investments to generate the capital invested in it, even if it's government funded, right? We should be better off invested elsewhere. So as we think about the sustainability of that, we necessarily, and that goes to this big gap question of right, in most African countries, it's less than 10%, and so it creates a problem with enough population where you can underwrite a lower cost of care, where you can tools that can actually reduce risk and that can actually reduce the cost per individual. Another big gap that needs to be solved. And in solving that issue, it would actually the cost of financing, right? Because you have you basically have a more robust with an ability to pay because we would have solved the universal financing issue. So, perspective of capital going into investment invested in the healthcare sector, but we also necessarily have to think about the payer side and how we can build that out to be able to sustain more sustainable way.
I was able to pick out a few things.
He still cuts through, but then yeah, I got the points that Dr. Sango was actually bringing, especially about venture capitalism and then also partnerships. Yeah.
Yeah, one of the things you really mentioned that I thought was very interesting, and I wanted to bring Jenny in, was scalability, especially for her operating in a private space. It means being able to access market, being able to raise the money, being able to even work with the government, public sector, to be able to have access, for example, to hospitals and some of the infrastructures. Jenny, how are you able to deal with this, and what are some of the highlights or key takeaway, rather the key challenges that you've faced in this space as a privately owned operated company?
Better regulation, but also working hand in hand with the government. At least for primary care, because our niche is primary care, right? It's very localized and it's governed at the local level in Nigeria. And
Yeah.
so having those strong partnerships with local government would definitely help with scalability, but also just other private entities, right? So like other players in the healthcare space, such as health insurance companies, HMOs, that will help to like with distribution, and working with other like either health tech startups or other like health entities in the value chain that will help with scalability. I don't think it's like a one size fit all. And when you go to different countries, they have their own regulation, they have their own like nuances when it comes to scaling into those countries. So it just really just depends. But I'll say like, what would really help is having strong regulation. I think, if you take Nigeria, for instance, a lot of the like healthcare is very, very fragmented. There are healthcare policies that have been implemented, but I don't think there's any accountability that comes when it comes to the regulation. There is a National Health Insurance Act that has recently been passed, but we're waiting for it to be implemented, and we're hoping that when it is implemented, that will also help encourage access to care, financing that healthcare. But I think like just having that regulation and and a government that's willing to put their weight behind infrastructure will really, really help with scalability. Otherwise, like the things that shouldn't take time to scale will take much longer to scale, or will not scale at all. Because we need that infrastructure, we need those policies, and it needs to be a joint effort with different like players in the space to help with that scalability.
I want to bring you back, Samuel, especially listening to Jenny, but also to comment on what Dr. Sango had mentioned earlier on in terms of financing models, and just hear your thoughts.
Yeah, I really agree with Dr. Sango, especially on the venture capitalism. But then I also think there is also the need where we do an impact investment in most of the projects that we are also doing, right? Where you have a direct investing entity that is actually implementing goals that you, an investment company, is actually looking out for as an outcome, right? There are a lot of investing companies out there that actually want to, or donors that actually want to give out money. However, there are also very few implementation agencies that actually have goals that fulfills their goals also. And that is where I think there's the need where impact investment is also needed. But then also there is the very great need where we need to look at the public-private partnerships, where when you look at public sectors and then the private sectors, there is always a very huge disparities where the public sectors have so much money, the private sectors have the tech, and they have the discipline, and then strict implementation methods, where there is a need for partnerships. A government can decide to give, a budget, right? But then it gives the budget to another public agencies who does very poor work in implementing it, which a private entity could have actually done better in doing that, right? And that is where I think there is a very clear need in public-private partnerships. One of the challenges that Zipline has since faced has actually been grants allocation to area logistics, where there is nothing like that, where all the big NGOs, the donor NGOs, actually still concentrate their money in ground transportation and ground logistics, which has so much challenges. Where if in African continent, most often than not, in all areas and locations, whenever it rains, nobody is able to move. Everything comes into a standstill. And that goes a long way to the detriment of the patients, to healthcare workers, and the community at large. But it is also an area where we've since had very huge challenges, and then we've not been able to actually get a very comprehensive solution to. But then we look at the area logistics where we are using drones in doing this with very little challenges, with so much success. In Rwanda, we've had a study, an independent study that was conducted by the Watson College of University of Pennsylvania. And then it came out that Zipline's operations in all the hospitals that we've been operating in has actually reduced maternal mortality by 89%.
Wow.
This hasn't actually been seen in any country at this magnitude. However, the big question is, how many donors are investing in Zipline to even do a much better work in still Rwanda with just the 12% that the 11% that is left, or even in other countries that there is so much maternal mortality burdens, right? And that is where we are as a company, and or we face as a challenge as a company, and where the government and donors are, where they don't actually invest so much in area logistics or very new technologies, because they think there is no security there, they think it is not safe to bet on. But yes, sometimes you just need to take a leap of faith in some of these areas to get things done. Yeah.
Is it though, Samuel? My thinking would be that actually a lot of investment into the healthcare is donor funded or public funded. I could be wrong, Dr. Sango, but this is my thinking. I think it's one of the biggest challenges. And for me, I even earlier on, I said it's the biggest dilemma, the infrastructure investment versus the innovations or technologies, which brings us back to the drawing board. I mean, Samuel, we've really gone into the chart, which was obviously supposed to be 45 minutes, and it's really been nice to have you. We've been having Jenny drop on and off, but I want to bring her in as we go to the last takeaways for this particular chat. I guess for me, as we really come to the last bits of this chat, I really would like to understand. We've talked about a few things in terms of scalability, which is a challenge. Obviously, you cannot scale up if you do not have the money, the investment, the financing, but also the public-private partnerships. Obviously, strides have been made. I think this is one of the key things I keep wanting to put out in terms of not even just vaccine manufacturing, but in terms of startups like Jenny's that are really trying to bridge this gap, Zipline itself, and a whole lot of companies within the space that are trying to provide access to healthcare. But this comes at the cost. When we say access, for me, one of the things I always also want to add is affordability. It's like, if you're making it easier for me, is it going to be affordable for me? And this is one of the things, questions I think a lot of people would like to ask. But as we come to the end, I mean, what is the starting point, really, if we really want to crack it, in especially providing not just getting people access to the services, but also affordable services?
Yes, I would like to take this first, and then my colleagues could come in on this.
Yeah.
So in Africa, affordability is very key. Access is very key. But also our per capita income is nothing to write home about. Yet we need quality medicines. There has been a very huge gap between the kind of quality care that is received in the urban area and that's in the rural areas. And there is a huge disparity there. In as much as we agree that the poverty index in the ex-urban area is higher than that in the urban areas, you would also know that the burden and expenditure is also higher still in the ex-urban areas where one, there's very little health care technicians in there. The hospitals there are smaller. The roads there are poorer, and a whole lot they don't have clean drinking waters, so they are actually prone to everything that could actually make one have a deteriorating health condition. These are the same people that are also plagued with, migration from ex-urban areas to urban areas, either for greener pastures or even for healthcare, in a much more deplorable state when that comes in. Yeah. And then the question has always been, why should that be the case? Why should those in the urban area be more human than those in the ex-urban area? And that is where, with the technology that Zipline actually has, we are able to bridge that. Now, when we come to the cost component, it actually much more is cost effective for the ex-urban folks at the same level as the urban folks, where the model that we operate in with is actually picking drugs from the central medical stores, which every country has. So from the capital, we pick the medicines and then put it in our ex-urban warehouse. And then we deliver these medicines to the health facilities. Now, there is no single interest on the medicines that is actually delivered. It is at the same price, the same quality that is also accessed by the urban people, right? So we are able to give equity to quality of healthcare in all the areas and all individuals, no matter where you are located, no matter the social and socio-economic status that you have, and then no matter the race that you are able to receive quality of care, you are able to receive quality medicines. One of the biggest problem in Africa is not actually knowledge. The biggest problem in Africa has to do with access. Right. So we have the knowledge, but then we do not have the equipment to work with. And that is where we come in, provide you with the equipment where you can actually leverage to use your extreme knowledge in combating. Africa, have we done so well? I think there is so much for us to do, but we have also come a very long way. We've done so much in this space. COVID was a test of our systems. We didn't do so well, but since then we've learned so much and we've built robust systems. One country that I am super proud of has actually been Rwanda, where the robust testing systems, the monitoring systems, and then the follow-up systems was like the best I could ever see. I had COVID, and then I had the Rwanda Biomedical Center call me on daily basis to make sure that I was doing well, to make sure I was quarantining, and to make sure I was actually taking the medicines and being in a very good status. And that's we don't actually see in first world countries or second world countries, right? But this is what was done in Rwanda that I am so proud of. Yeah, so we have a long way to go, but we have also come a long way.
And obviously, I personally come from Rwanda. I also understand how important it is really for accessibility. I know that, Rwanda has also been intentional and many other countries. And staying here in Senegal, I've also seen the strides being made, especially in terms of, for example, manufacturing vaccines, not just for COVID-19, but also for other, malaria, yellow fever, actually it's yellow fever. And you see all of that progress being made. There's a lot really happening. Dr. Sangu, as Samuel was speaking, we are not able to get Jenny on, but I really want to bring you on as we come to the end of the chat. Obviously, there's a lot that has, hello?
Yes.
There's a lot that Samuel has touched on, and we all agree strides have been made, but there's still a very long way to go. When you think about the private public partnerships that have been made, there's still a huge gap and a long way to go. In infrastructure itself, even we can't hold a conversation online. So when it comes to telemedicine, there's still a huge long way to go. In terms of manufacturing, or even being able to get these drugs. And I think it goes beyond just even the access itself. And for me, that brings me to, my question as we come to the end. Where do we start? What could be the starting point that we could actually even be missing out on?
There are a couple of things I'll say in a slight pushback. I would fundamentally disagree there. I think that there are massive gaps. I think when it comes to general perspective, but as there's been a massive shift in disease burden and you see the increase, we have a serious problem. Let me tell you, one issue we have that very few geriatric experts across the continent, right? Which is top 5 disease burden across the continent. In most places, we have less than 1 dermatologist, where the number of neurosurgeons there you can count on your fingers, right? So there are diseases that we actually have, especially when it comes to certain specialties. So one part of it, factor in the fact that I mentioned earlier, the chronic shortages in the West, and a place that they'll come to collect doctors and nurses. It means that it's heavy investing in training and development, where we need to train about meeting and think about it from a global perspective, where we can actually not only train for Africa, but this will, I think this taken seriously will help solve the problem, doctor-patient ratio, and it will also solve this global phenomena that's about it or not. And so by us actually taking this phenomena that's depleting our rights and training for the broader world, I think it will position us. The second thing that I think is the financing side. Part of the reason why almost everybody can afford car insurance, right? From your little insurance, because it's mandated by law. And because it's mandated by law, everyone is covered, and that's allowed underwriting risks to be greatly reduced, which makes it such that it becomes affordable. In fact, no part of the world has ever successfully been able to achieve care without solving this issue of universal finance. It's never this issue. So this issue is one issue that has to be really focused on and solved. And the last point out, technology and all of that is great, but also unfortunately sometimes can exacerbate and create new inequalities between the digital. You know, if you talk to the director of the district hospital, rate of 71%, and if you want to talk to him and tell him that, oh, you're going to send zip line, so before we are thinking of flying things in the air, can we just make sure that we have a monitor? The mental basics need to be there.
Yeah, so it goes beyond technology, but it's for me, I think one of the points I'm taking away is capacity and being able to, to build the capacity within and have enough doctors or nurses within the areas. Jenny, are you able to connect now? I feel like technology has failed us today, but because panelists are dropping on and off. Are you able to hear me, Jenny?
Yes, I can hear you.
Oh my God, it's good to have you back. My two panelists dropped off. So it's a question of, can we really be able to create a lot of change with on and off technology? But one of the things that the panelists really mentioned earlier on that we really wanted you to weigh in before we close, since now I'm happy to have you back. I hope you don't drop off. I think I think Dr. Sango had mentioned a lot around financing and using the private sector. And obviously, because I know that you're operating a private company, in terms of, you know, raising the financing vis-a-vis affordability, this is a big question. The amount of investments you put in vis-a-vis how much money, for example, you're going to charge the patients. I'm sure this is something you too as well have to factor in your day-to-day business. How do you deal with that?
So if you're asking is like, how do I reconcile the money
Yeah.
that you'd have to raise with the um, with how much we have to charge our customers
Yes.
to be
Yes,
able
because
to
accessibility is one thing, but also affordability is another thing.
yeah. Yeah. So for us, right, like, so I would say that one of our core tenets is affordability. And so one of the things that I also have to kind of like, I won't say caution, but like help investors who have invested in Claflin and bring them up to speed is that,
Yeah.
you know, because of our niche and because of our target market, we have to price our services in a certain way.
Mm,
Otherwise, like we're not able to meet our, you know, what our other tenet, which is accessibility, right? Those
mm,
two things go hand in hand. And so, but honestly, I think it's more so of like having the right capital that will allow you to price your services in a certain way. Right now, we've leveraged VC capital and then or venture capital and grants to, you know, help us price the way price our services in the way they're priced now. But at some point, like as we grow and scale, we're going to need other kinds of funding, such as like either like patient capital, either debt or private equity. I'm not sure, but different kinds of like finances or blended finances, I think, would help to,
mm.
you know, justify like why we're pricing our services the way we are, and also help drive down our prices as well, if we indeed then want to start targeting the bottom of the pyramid. But I think the way, like, I think like ultimately we just have to reconcile in our minds that like Africa is a different market than it is in the United States, right? There is money on the continent, but not a lot of people have like that high purchasing power in order to, like, you know, reconcile like receiving this amount of investment, but then charging your customer X amount of money. It's a game of numbers. And so just striking that balance, I think, is ultimate key. It's not one size fit all.
Yeah, absolutely. I know we've gone past time. We've had you drop on and off. I'm so sorry about that. Sometimes I feel like we've been using online platforms for quite some time, but you can never be sure when it drops off. And I won't let you go without putting this up, because I would love your closing remarks. Obviously, we've talked about infrastructure. I think a little bit in mid-conversation, we talked about public-private partnerships, but we also talked about scalability, supply, demand, and all of that. But in your own perspective, sometimes it's nice to even look at beyond technology. When we talk about the role of innovation and research, it's really broader. Where do we start from? And what is that we really need to address if we really want to be able to hack it?
Yeah, I think we just need an enabling environment. And so that will include having strong policies, better
Yeah.
infrastructure, human capital, right? Like we don't have the enough capacity to serve the population, Africa's population, right? The health practitioners that we currently have on the continent are leaving, and for better opportunities, and we can't blame them for doing that, right? But we're also not training people fast enough to be able to meet our growing, you know, population, right? So these are the things that we have to do in order to ensure that like tech can ultimately play its role in ensuring that we can increase access to healthcare. also across the continent and make it more sustainable and affordable, right? However way we decide we want to approach it, I think we fundamentally we need that enabling environment. And one thing I also want to say is like dedicating like what I would call like centers of excellence for research and development, where these entities are there to just
Isn't
do
that like
development.
universities?
Yes, so it could be universities, but it also could be like dedicated
Research
lab
centers, like
research centers.
laboratories
Yeah,
that,
yeah,
yeah.
exactly. Yeah, where like we are like they're just there to like, do research and development and like come up with either like new technologies or new initiatives that can be commercialized and benefit the public, right? I think that will be very, very beneficial. But that, goes back to, we need to have those
The
policies in
money.
place.
So, but
Yeah, you need to have.
again, it takes us back to the question of financing, because these research centers, you need money to set them up. You need, a lot of funding to be able. Sustainability is very crucial, when you talk about this. But one thing I'm picking from you is that even with technology, research, and investment in research, it has to be massive to enable technology also do its course.
Yeah, yeah. I mean, I like speaking from my experience in the United States, right? The U.S. government throws a lot of money to research and development. They have like centers of excellence. They leverage universities for that research and development, right? So, but that comes from like a concerted effort to fund that. There's also some partnership, like private-public partnerships as well to fund that research and development. So we can't just rely on like one source of funding. It needs to be like a joint effort between the government, between the private sector, corporate, whatever the case might be, to help fund that research and development, but also to ensure that like the research that comes out of these universities or that come out of these centers of excellence can be commercialized to now make that loop sustainable, right? Because we are pushing out like innovative things that can be commercialized, that can be used to like generate revenue, and then that revenue is brought back into to help like fund more research and
Yeah.
development. But it would really take like these policies of people who care enough to want to make that happen. Otherwise it would just be a lot of talk but no action.
Yeah, and it's more like there's gonna be a supporting environment to make all of this
Hmm.
happen. Jenny,
Yeah.
I really want to thank you so much for making the time. I really want to say to those watching right now, a huge thank you for tuning in, and apologies for the technology drop in and out. Now it's stable, which is so interesting because I can hear you, I can see you, and it's interesting because earlier on it was on and off, which is funny. But again, I think that's one of the infrastructure challenges that we keep experiencing in Africa. And again, we hope that the good work that has been done can actually be sustained. And obviously, well done, Jenny, for the work that you're doing in the space, and for everyone for tuning in. I think one of my key takeaways is that it's not just that technology is going to drive or disrupt the health sector. Absolutely not. But it has a role to play if supported, obviously. If, like you mentioned, investment is made in research, but also if there's proper infrastructure, if there's an enabling environment, then you can actually enable innovations and all the technologies that you've spoken about to be able to not only give access to the people, but also make it more affordable.
Yeah,
Jenny, thank you
definitely.
so much for making the time. Thanks to my panelists as well that dropped on a little bit earlier. We had Seneca Samuel, who works with Zipline, and we had Dr. Sangu Dele, the CEO of the Africa Health Holdings, and Jenny Nokoye, who is also the CEO of Clafia. Thanks a lot for everybody that has tuned in. And we hope to continue the conversations. It's not the end of it. I mean, it's very nice to draw from experiences and see what challenges you face, but also what could be done to really make it easier, make it possible for people to be able to access health services. I wish you all a very wonderful weekend, afternoon, evening, and morning, and see you soon.